Hi, and welcome to Developmental Psychology Week 7. Today we're going to talk about Chapter 13, Physical and Cognitive Development and Emerging in Young Adulthood. Let's start with our learning objectives. To be able to describe the transition from adolescence to adulthood. To be able to summarize physical development in young adults. To be able to discuss sexuality in young adults. To characterize cognitive changes in early adulthood, to identify examples of the roles of experience, culture, and gender in adult moral development, and to explain how emerging adults make the transitions to higher education and work. Emerging adulthood. The road to adulthood may be marked by entering college, working, moving away from home, and getting married and having children. For many young people, the late teens through mid to late 20s is a distinct period of emerging adulthood between adolescence and adulthood. Health status. Most emerging and young adults in the United States report being in good to excellent health. Accidents are the leading cause of death for young Americans aged 15 to 24. Emerging and young adults have consistently been associated with lower socioeconomic status and levels of health insurance of any age group. They often have no regular access to health care. COVID-19 risk of death is often lower, but long COVID is a risk for this developmental stage. Genetic influences on health. The interaction of genes and environment lead to the expression of obesity, certain cancers, and asthma. A genetic variant influences the development of symptoms of depression. In a supportive family environment, depression risk is not elevated. In the absence of such an environment, the gene increases the risk. Diet and nutrition. In 2017, 11 million deaths across the world could be attributed to dietary risk factors. The World Health Organization recommends a diet rich in fruits, vegetables, whole grains, and unsaturated fats. Since 1975, the global obesity rate has almost tripled. In 2016, there were 1.9 billion overweight adults, 650 million of whom were obese. Much of the increase is due to globalization, including increased availability of nutrient-poor, high-calorie processed foods. In the United States, in 2020, 41.9% of adults were obese. Increases in obesity are due to increases in snacking, inexpensive fast food, supersized portions, high-fat diets, labor-saving technologies, and sedentary recreation. Obesity is associated with many health risks, including depression, high blood pressure, heart disease, stroke, diabetes, arthritis, and some cancers. Lifestyle changes or drug treatments can create weight loss, but the losses are difficult to maintain. Physical activity. The benefits of being physically active include maintaining a desirable body weight, building muscle, strengthening the heart and lungs, and protection against heart disease, stroke, diabetes, osteoporosis, and disease. Stress. High levels of stress are related to a host of physical and immunological impairments. In some cases, stress leads young adults to engage in drinking or smoking. Stressed out college students are more likely to eat junk food, exercise less, and have poor sleep. College-age women are more likely to use emotion-focused coping than college-age men and experience higher overall levels of stress. Sleep. The transition from adolescence to emerging adulthood is often marked by worsening sleep. Sleep deprivation impairs physical health and cognitive, emotional, and social functioning. The primary cognitive consequence is impaired attention and vigilance. Sleep deprivation is linked with poor academic performance, higher stress, enhanced emotional reactivity to negative events, and increased risk for some psychological disorders. Smoking. Smoking is the leading preventable cause of death worldwide. It is linked to lung cancer, heart disease, and about 1 in 5 American deaths. Many smokers require multiple attempts to quit the habit. Giving up smoking reduces the risk of heart disease, cancer, and stroke. Window on the world. Internet addiction. Internet addiction is a compulsive need to engage in non-work online activities to the point where such activities are interfering with family, social life, or work. The prevalence of internet addiction is estimated to be approximately 14.22% worldwide. As the use of technology spreads more broadly beyond the borders of the developed world, we can expect to see the influence of this new risk spread. Alcohol use. In the United States, alcohol use peaks in emerging adulthood. Among adults aged 18 to 25, about 50% drank alcohol in the past month. Heavy drinking over the years may lead to high blood pressure, cardiac disease, stroke, various cancers, cirrhosis of the liver, damage to the nervous system, and psychosis. 1/3 of vehicle fatalities are alcohol related. This figure gives us information about the percentage of people in this developmental stage that have used alcohol in the last month, have binged alcohol in the last month, or admit to heavy alcohol use. Higher income people rate their health as better and live longer than lower income people. This is an impact of socioeconomic status on health. Lower education is associated with developing diseases, injuries, and chronic ailments, or becoming victims of homicide or suicide. Race and ethnicity. Because many minorities in the United States also tend to have a lower socioeconomic status, their health issues stem from their socioeconomic status rather than minority status per se. Black Americans are more likely to suffer from and die of heart disease and be diagnosed with diabetes. Discrimination can lead to unconscious bias on the part of physicians and poverty. Relationships and health. Health and well-being are associated with the quality of a person's social relationships. Loneliness, social isolation, and low-quality relationships are associated with increased risk of heart disease, stroke, depression, and anxiety. Social support refers to material, informational, and psychological resources derived from a social network to cope with stress. Marriage offers a readily available system of both social integration and social support. It is not surprising that marriage tends to benefit health. Married people, particularly in young adulthood, tend to be healthier physically and psychologically relative to those who are never married, cohabitating, widowed, separated, or divorced. Conversely, people in an unhappy marriage have poorer health than single adults. Alcoholism. Alcohol abuse and dependence are global issues responsible for 5.3% of deaths worldwide. Alcoholism is a long-term physical condition characterized by compulsive drinking that a person is unable to control. Treatment includes detoxification, hospitalization, medication, individual and group psychotherapy, and support organizations. Drug use and abuse. Use of illicit drugs peaks at ages 18 to 25. Almost 24% of this age group report using illicit drugs in the past month. Usage rates drop sharply during the late 20s and then continue to decline as people enter later adulthood and old age. Marijuana is by far the most popular illicit drug among young adults. Depression. Starting at about age 13, the incidence of depression increases gradually. People with major depressive disorders often have depressed or irritable moods for most of the day, show reduced interest in previously pleasurable activities, experience significant changes in weight, and have difficulty sleeping. Young women are more likely to suffer from a major depressive episode. Sexual behavior and attitudes. Almost all U.S. adults have had sexual relations before marriage. Emerging adults tend to have more sexual partners than adults in older age groups, but they have sex less frequently. Casual sex is common on college campuses. Sexual assaults on women are also a problem in this age group. By emerging adulthood, most LGBTQ+ individuals are clear about their sexual identity. Sexually transmitted infections, or STIs, are illnesses that are transmitted by having sex. Worldwide, approximately 38.4 million adults are living with HIV in 2021. The risk of STIs has been climbing steadily. Infertility is the inability to conceive a child after 12 months of sexual intercourse without birth control. Sometimes hormone treatment, drug therapy, or surgery may correct the problem. Perspectives on adult cognition. Young adults can engage in reflective thinking, which involves continuous, active evaluation of information and beliefs in the light of evidence and implications. A higher stage of adult cognition is post-formal thought, relying on subjective experience and intuition as well as logic. It allows room for ambiguity, contradictions, and compromise. Triarchic theory of intelligence. In contrast to Piaget's emphasis on analytical thinking, Sternberg's triarchic theory of intelligence includes 3 types of knowledge: componential, which is analytic; experiential, which is creative; and contextual, which is practical. According to Sternberg, componential knowledge is necessary but insufficient to do well in life. Successful adults also rely on tacit knowledge, which is information that is not formally taught but is necessary to get ahead. Emotional intelligence refers to 4 related skills: the abilities to perceive, use, understand, and manage or regulate emotions of our own and those of others so as to achieve goals. College students with high emotional intelligence are more likely to report positive relationships with parents, friends, and romantic partners. Among employees, Higher scores are related to higher salaries and more promotions. Moral reasoning. In the final stage of Kohlberg's moral development, post-conventional morality, when people become fully capable of fully principled moral reasoning based on universal principles of justice, has begun. Kohlberg argued that most people do not reach post-conventional reasoning based on universal principles until their 20s, if at all. The three ethics. Individualistic cultures focus on individual autonomy. Collectivistic cultures focus on group dynamics and harmony. This may help explain some of the cultural differences in moral reasoning. The ethic of autonomy is characteristic of individualistic cultures and divinity. The ethic of community is characteristic of collectivistic cultures and focuses on social connections and duty to others. The ethic of divinity focuses on the divine soul. College. College is an increasingly important path to adulthood. Enrollments in the United States are at an all-time high. More than 2 out of 3 high school graduates go right to college. Between 1960 and 2017, the proportion of U.S. high school graduates who went straight to a 2 or 4 year college grew from less than half, which was 45%, then more to more than 2/3, which was 69%. College courses are now widely available by distance learning. Colleges are also increasingly experimenting with hybrid courses that combine online and in-person techniques. Women now make up a larger percentage, 58%, of the student population in comparison to men. In the United States, women remain more likely than men to major in health professions, psychology, and biology, but they have made gains in almost every field, with math-intensive fields the only remaining field where this is not true. The cost of college attendance makes attainment of higher education increasingly difficult for low and middle income families. In the 2019 to 2020 academic year, the average total net price of attendance at a 4-year college or university for a full-time undergraduate at a public institution was $14,200. Private institutions were about double the cost at an average of $23,200 a year. Research in action, the rose that grew from concrete. Data shows that when separated by gender and race, Black girls have the highest proportion of all indicators of school push-out. Black girls are suspended and drop out of school at higher rates than their white peers, and typically have less access to supportive relationships and resources. Roses, a youth-led community intervention program, increases girls' access to community resources using relational advocacy and focusing on multiple areas of influence within the girls' lives. For example, peers, family, juvenile justice system, etc. Completing college. The 6-year graduation rate at 4-year institutions is about 64%. Graduation depends on motivation, academic aptitude and preparation, independent work, social integration, and social support. Work. By their mid-20s, most emerging adults are either working or pursuing advanced education or both. While previous generations could expect to remain at a company from start date until retirement, that pattern of employment is becoming increasingly rare. More and more self-employed, working at home, telecommuting on flexible schedules, or acting as independent contractors. Higher education expands employment opportunities and earning power. In the United States, adults with advanced degrees earn almost 2 times more than those with less than a high school diploma. Income differentials between male and female workers exist at all levels of educational attainment, but those gaps have narrowed considerably. In 1979, women earned 62% of what men did. In 2020, women earn 83% of men's income. Combined work and schooling. In 2014, about 40% of full-time college students and 74% of part-time college students worked while attending college. Working during college may affect the likelihood of attending graduate programs. Such work cuts into the time available to engage in other activities, such as participation in research groups, unpaid internships, and volunteer work. This in turn can affect having a competitive application to graduate school. Cognitive growth at work. People seem to grow in challenging jobs, the kind that become increasingly prevalent today. Substantive complexity at work that requires thought and independent judgment is associated with a person's flexibility in coping. According to the spillover hypothesis, cognitive gains at work carry over to non-working hours. Substantive complexity at work strongly influences the intellectual level of leisure activities.